On our program, we move into a discussion now with Dr. Jonathan Aviv, who is a guest who has spoken with us previously on this program. We had a very interesting discussion, and I have a feeling that we will this hour, too. There's a lot to get into in the chat with Dr. Aviv. A little bit later in this hour, we may be able to work in some thoughts from some of the people listening to us. When you hear the topic, some of you are probably going to jump to your phones immediately. Dr. Aviv is the clinical director and founder of the Voice and Swallowing Center at ENT and Allergy Associates, LLP, here in New York City. He is also clinical professor of otolaryngology, Icahn School of Medicine at Mount Sinai, and an attending physician in the Mount Sinai Hospital in New York. He's the inventor and developer of the endoscopic air pulse laryngeal sensory testing technology, which is known as, I believe the correct pronunciation is FEEST, F-E-E-S-S-T. And he has quite an accomplished background. He's the author of Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux and its Connection to America's Fastest-Growing Cancer with a Diet That May Save Your Life. Yes, I used those words, acid reflux. I can only imagine the reaction coming from some of you who are listening to our discussion today. Dr. Aviv, it's nice to have you join us again on our program. Good morning.
Thank you so much for the invitation.
Beginning this discussion, that term acid reflux, a lot of people hear it. Some people are familiar with this on a daily basis. What exactly is acid reflux?
Acid reflux is stomach acid that instead of going down away from the rest of the body, goes the wrong way. It goes up to adjacent structures. The two adjacent structures to the stomach are the esophagus, which connects the throat to the stomach, and at the top of the esophagus are your vocal cords and lungs. So stomach acid going the wrong way, like a car going the wrong way on the LIE, is going to cause a lot of problems.
When we talk about acid reflux and the numbers of people who are affected by this, what are we talking about? Does anybody have any idea?
Yes, it's actually remarkable the number of people that have acid reflux here in the United States. Estimates are about 60 million people, 60 million. People complain of feeling of heartburn or related symptoms once a week to the tune of almost 30% of the population.
When we talk about those symptoms, how do they most often play out?
Well, this is one of the critical questions. People say acid reflux equals heartburn. However, as it turns out, an even riskier form of these symptoms are what I call throat burn reflux, to distinguish it from what everyone seems to think of as, it's just heartburn. And what is throat burn reflux? It's a term that I coined in Killing Me Softly from Inside that means acid reflux disease without this classic symptom of heartburn. So instead of heartburn, patients complain of chronic cough, hoarseness, excessive throat clearing, and a lump-like sensation in the throat.
And when we're talking about, I asked you about the numbers of people with acid reflux, but who is it who, I guess, I want to say either is most susceptible or who actually can get acid reflux?
Right. So acid reflux does not respect age. In my book, I talk about my daughter when she was days old, who had such a severe acid reflux episode that she stopped breathing and had to go to the emergency room. So we see acid reflux in children. We see acid reflux in adults. And specific answer to your question, who gets this? Generally, it's related to the food we're putting in our system. And in my book, I talk about what led us to this situation where acid reflux and its consequences, the most dire of which is esophageal cancer, have to do with, believe it or not, events that took place in the 70s here in this country.
What events?
Well, two things happened in the 1970s that have led us to this state that we're in, where esophageal cancer, that's the cancer due to insufficiently or untreated acid reflux, is by far the fastest growing cancer in America. When I say by far, almost every cancer since the mid-70s is either down or flat. There is one that has a slope that's heading to the moon, and that's esophageal. So what happened? Two things happened. Legislative intervention by the government and changes in the food industry. I'll talk about the legislative intervention. In the mid-70s, a little-known FDA, Food and Drug Administration law called Title 21 mandated that any food in a can or a bottle needs to be acidified to act as a preservative to prevent food poisoning. So great concept. Let's not get food poisoning. However, the unintended consequence of this was that food items that we thought should be exceedingly safe turn out to be a bit harmful. And the best example, I'll drill it down to one example, which will resonate to you and to your listeners. A banana, right? Mm-hmm. We love bananas. Tasty, whole food, healthy. And a banana has a relative acidity of almost near neutral. pH is the term perhaps we've heard of from our high school chemistry classes that measures relative acidity. A neutral pH is around 7. Anything very, very acidic is 2, 3, or 4. So we want to eat foods typically above 4 or 5. Okay, so banana is right around a 6. However, when you have baby banana food in a bottle, the pH is around 4. It's 100 times more acidic. And that's because of the preservatives used to make sure that there's no food poisoning or no bacterial overgrowth. So, imagine that. In one hand, you're holding up a banana. In your other hand, you're holding up a jar of baby banana food, right? So, these problems started way back when. Then the food industry, again, inadvertently and unwittingly, have contributed to this. So what happened at that time? The best example, again, is sugar. In the late 70s, sugar went from the more expensive cane and beet sugar to the less expensive corn-based sugar with the creation of something called high fructose corn syrup, which we've heard about. But as people say, well, what's wrong with high fructose corn syrup? Well, a few problems. One, it contains something called sulfuric acid, which is very acidic. On top of that, the chemicals used in the processing of this food have a physiologic effect of loosening the muscle that separates the stomach from the esophagus. So what we talked about at the top portion of the show, what is acid reflux? That's stomach acid coming up. Well, the body has a natural ability to prevent that, this muscle. But the chemicals in the processing deactivate this muscle.
When we talk about untreated acid reflux, what does that mean for the likelihood or the potential of an initial heart attack?
This is a new study that was just presented in May this year at one of the big gastrointestinal meetings. And I'm familiar with this study. What the investigator showed was that people that have the traditional heartburn symptoms initially were found to have a 6-fold, that's a 6 times increase in getting a heart attack. However, when they controlled for various factors such as obesity, gender, and some other lifestyle choices like smoking, yes or no. They found that people with heartburn had about a 50 to 60% increased chance of getting a heart attack. And they were wondering, how could this be? Plus, and this is one of the most interesting parts of the study and dovetails towards what we're talking about, which is using food as medicine. They said when you treat the acid reflux with antacid medication, that 57 or 60% increase in heart attack chance goes away. So what the investigator was saying was that anything inflammatory, so an inflammatory diet can lead to inflammatory changes in the body, which can precipitate a heart attack. The prevailing theory about heart disease and heart attack is that inflammation of the blood vessels that supply the heart is the primary culprit, and that very often things we eat cause inflammation. So if you look at the top, the trunk of the tree is inflammation, and all the problems stem from unabated, unchecked inflammation.
We're talking on our program on The Fan, Sports Radio 66, Sports Radio 1019, with Dr. Jonathan Aviv. He is the author of Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux and Its Connection to America's Fastest-Growing Cancer with a Diet That May Save Your Life. We'll get into talking about the book in the course of this discussion. When we talk about acid reflux and this idea of its incidence, how does sleep affect that?
Again, there's recent studies that, and by the way, I'm very impressed with your knowledge about the latest and the greatest on this subject.
Thank you.
You bring up fantastic points. First about heart attack and that being mitigated by treatment and inflammation as the cause. And let's go a few steps further. A recent study showed that the amount of reflux that occurs during nap time is greater than nighttime sleep. And investigators, again, were somewhat surprised by this and trying to figure out how could this be. And then as they drilled down and looked at the results of the study, what they surmised was that people that are taking naps during the day, invariably, they've just eaten something. The classical situation is someone's had a big meal, a midday meal, and you get a little tired after that, and they lie down for a short time, 30 minutes, 40 minutes, sometimes even less, to recover from the meal and to feel refreshed to tackle the rest of the day. Well, what happens? We normally reflux, that means stomach acid going up into the esophagus and adjacent structure, about 50 times a day, all related to meals. And if you think about it, it makes sense. As you're eating, the stomach is producing acid, you need a little safety valve, right, to relieve some of the pressure as the food is being digested. Now imagine, and you're upright when you're eating. Most people are not lying down when eating. Imagine as this natural reflux is going on, instead of being upright, you decide to lay down. That's terrible because all that stomach acid is now going to slosh right up into your chest, up into your throat. And that's what they feel is the major cause of nap time related increase in acid reflux. It has to do with taking away gravity as your friend.
Dr. Jonathan Aviv talking with us on our program. We haven't even gotten into talking about your book. It's entitled Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux and Its Connection to America's Fastest-Growing Cancer with a Diet That May Save Your Life. What I said we would do as well is something we don't often get to do on this program. And it's something that I do like to do. With this discussion today, I had a feeling we'd have some interest from some of the folks who are listening to us fairly early in our discussion, so let's try to take some calls now. WFAN's toll-free line, 877-337-6666. It's brought to you by the Endless Summer Party at Resorts AC, managed by Mohegan Sun. And let's go first on the phone to, let's see who we start up with here. Let's head to Bill in Flushing. Bill, thanks for holding on so long. Welcome to the Fan.
Yeah. Good morning, guys.
Good morning.
Good morning.
I had acid reflux about 10 years ago. I was getting into some health problems. So I decided, I read a book, Fresh Fruits and Vegetables by Norman Walker. Did you ever hear of him?
No, but that's okay.
Okay. What he preached was extracted raw juices from vegetables.
Mm-hmm.
Now, I do about 12 different vegetables that I extract. About 8 ounces a day, maybe over 200 gallons a year. And I was doing it 7 years, and the acid reflux disappeared, among other good things that happened to me. Hello?
Yes. Well, you hit the nail on the head. In my book, I introduce a diet called the Acid Watcher diet, which is a low-acid, high-fiber diet that has a balanced amount of the 3 macronutrients, that being proteins, fats, and carbs. And it's designed to heal the body from years of acid damage. The Acid Watcher diet is not a deprivation diet. In other words, I say eat a balanced amount, don't restrict fats, don't restrict carbs. And in the diet, a couple of the mainstays, very similar to what you're talking about, is a pound of vegetables a day, preferably raw, and we could talk about that, and half a pound of fruit, which is, again, similar to what you're talking about. And I believe in the adage, green is good. Almost anything green is very, very healthy for you and absolutely can mitigate acid reflux. I think that one of the things you have to be careful about when just juicing is that with juicing, you often lose the fiber, right?
Well, you can get that through other ways.
Yes, right. But even at the same time, you just have to be careful with that. You're fortunate that you pay attention to the fiber piece.
Well, the grapefruit juice, and that thing that clogs up, that goes in the lining of the your bowels, and it makes everything flow easy. The grapefruit juice, the raw grapefruit juice, not bottled,
Yeah, the grapefruit. Yeah, the one thing you have to be careful about, and again, you touch upon something very important. People talk about lemon juice, apple cider vinegar, grapefruit. One of the problems with those types of highly acidic foods is that they activate something called pepsin receptors in the throat. Pepsin is a molecule that breaks down protein, typically sits in the stomach. But with refluxers, it can actually creep up, and these receptors can sit in the throat and in the esophagus, and they get activated at very, very acidic or low pHs. And when drinking things like lemon juice and vinegar and grapefruit, what happens is that these receptors get activated and actually begin causing a tremendous amount of inflammation in the throat and the esophagus. So that's one of the things that people need to be aware of. In your particular situation, the amount of vegetables that you're having is having a very positive effect, and you're to be commended for that.
Yeah, you have, you see, as he explains in the book, and you should really read it, it's my Bible. There's Fresh Fruits and Vegetables by Norman Walker. And he lasted to about 109. But he described how to get your bones strong. Turnip leaves, dandelions, this helps bone strength. Spinach regenerates your blood.
Yes, as I said, the Acid Watcher diet, insists on a pound of vegetables a day, which, again, the fiber component, which you're getting. Other ways, there's several advantages of fiber. You think of fiber as acting as a virtual broom, sweeping away impurities from the stomach and intestines, which, again, loosens and lessens the amount of pressure on the muscle that separates the stomach from the esophagus.
Yeah, I have no problem anymore. And,
okay.
I mean, it takes a lot of effort to do this. Like the other day, I spent 5 hours, processing it, washing it, processing it. It takes time.
But
you ever hear of Norwalk juicer machine?
Yeah, I have. I know exactly what you're talking about.
Hello?
Well, Bill, I know exactly what you're talking about. Bill, thank you for your call this morning. We've got to work some other people into this discussion, too. Let's see. We'll go next to Long Island. Let's go to Vito, who's been holding for some time. Vito, thanks for holding on so long. Welcome to the Fan.
Hi, good morning, Bob. Good morning, Doc.
Good morning, Vito.
Thank you. Sometimes I wake up in the middle of the night, I get like a burning sensation in my throat, and it's like acidy or whatever it is. But years ago, I had echolalia surgery done on my where the stomach meets the esophagus.
Yes.
And I get tested once every couple of years. I go for an endoscopy, I think they call it.
Yes.
Of the throat. And my doctor always tells me everything is fine, just like a little redness where my esophagus meets the stomach, and he tells me it's nothing to worry about. But when I eat spicy food sometimes, occasionally I realize that it spurs the acidity. I guess I should stay away from the spicy foods and stuff like that.
Well, you bring up a lot of good points. First of all, Vito, I can relate to your symptoms. In the first page of my book, Killing Me Softly from Inside, I describe exactly what happened to you. I woke up in the middle of the night choking, and I didn't know what was going on. And then I realized it's probably acid reflux. My own doctor said, "No way. You never complained of heartburn." And, it was a throat symptom, and this like sudden choking in the middle of the night. We call it a jump up, because with the choking, you literally jump up in bed, which is similar to what you're describing. So, that led to my journey. It's just interesting that's your story too. And while I didn't have surgery, I did come up with a food as medicine way to treat this. And as you're talking about, what to eat, what's safe to eat, there are two ways to approach this. One is certain things to avoid. You talked about spicy foods. There are certain common foods that should be avoided, such as caffeine, chocolate, alcohol, mint, citrus, tomato, onion, garlic. Now, I know I've just mentioned your 8 favorite food groups, right? Oh, no. Is there anything left to eat? Suddenly our entire diet is 8 foods, right? We never eat anything else but those 8 things. Well, that's not the case. In addition, the Acid Watcher diet has something called non-negotiables. That means these tenets, these points must be followed. Number one, and this goes back to what Bob was saying earlier about the NAP study, no lying down within 3 hours after eating. The other is no smoking of any substances, no smokables. The other is no prepackaged or processed foods, including no soda. So if you can combine the no's with some of these non-negotiables, what then opens up is an entire world of very, very healthy and tasty options. Unlike Bill saying it took 5 hours to prepare and to wash, as it turns out, the recipes in my book and in the Acid Watcher diet take about 5 to 10 minutes to make. So they're designed for people on the go who don't have time. One of the problems with someone who has acid reflux and they're spending a lot of time in the kitchen, say marinating in the kitchen, it's like the fox guarding the hen house, right? If you're reflux, you don't want to be sitting there making these elaborate meals. You want meals that are quick, tasty, inexpensive, that are low in acid, high in fiber, and nutritionally balanced.
Vito, thank you for your call this morning.
Doc. Thank you, Doc.
Interesting discussion. If you want to join us in our discussion, 877-337-6666. We're talking with Dr. Jonathan Aviv on our program on The Fan. The book that I've referenced a couple of different times, what was it like for you in doing that book?
I'm sorry, say that again.
The book, Killing Me Softly from Inside. What was it like for you in doing that book?
Well, the one of the fascinating things was that, I experienced this, just as Vito said, and as you brought up in the beginning of the show, millions of Americans have this problem. But one of the things that millions of people don't realize, and this is one of the take-home messages, is sometimes it's not heartburn, it's the throat. And if you have things like chronic cough, hoarseness, lump-like sensation in the throat, a feeling of excessive throat clearing, don't feel right away that, this must be my allergies kicking up, or it may be asthma. Go to your doctor. Chronic means more than 8 weeks. Go to your doctor, explain your symptoms, and ultimately get your throat and esophagus looked at.
When we're talking about this topic, Dr. Aviv, some people may wonder, well, is there medication that will help?
Yes. One of the most commonly purchased medications in our society are over-the-counter antacid medications, and they help. In addition, there are prescription medications, 2 different classes that are used to treat acid reflux. And in fact, again, relating to your study that you described earlier on heart attack and acid reflux, a class of drug called proton pump inhibitor, what they discussed in the study was a drug called Nexium. When that's used, you take away the heart attack risk because of the anti-inflammatory effect of the Nexium. But again, as I'm sure you're aware, over the years, studies are increasingly showing that prolonged use of these medications has certain side effects, the most notable one being a leaching of calcium. So as one progresses in life, bones get weaker and can predispose to fractures. So ultimately, what we want to do is, again, use food as medicine. I like the concept of saying, become an acid watcher. Pay attention to the acidity of the foods that you're eating and follow simple plans to keep this inflammation away.
We are in discussion on our program with Dr. Jonathan Aviv. He is author of Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux and Its Connection to America's Fastest Growing Cancer with a Diet That May Save Your Life. Great discussion we're having with Dr. Aviv on our program. Rick Wolf is along after our 8 o'clock update with the Sports Edge. Ed Randall talks baseball after our 9 o'clock update. And what we're going to do is try to work in some more folks via the telephone here at 877-337-6666. Folks who are holding, let's go first to, Mike in Bethlehem. Mike, good morning. Welcome to the family.
Hey, good morning.
Hi, Mike.
I'm only 24 years old, but I've had acid reflux for the past 2, maybe 3 years, and one of the big problems, like you said, was just the amount of soda that I was drinking.
Right.
So once I cut out the soda, you cut out the coffee, I had an issue getting energy during the day, and maybe you could shed some light on this because I'm not a doctor by any means, but I switched over to yerba mate, and if you don't know what it is, or for those that don't know what it is, it's basically just an herbal tea from Paraguay. They grow it in the rainforest, and starting to gain popularity in the States now. And like I said, you drink yerba mate, it's an herbal tea, and my acid reflux is basically gone within 30 seconds to about a minute.
Well, Mike, I think it's great that you recognize that soda was a problem and you did the tough thing, which is cutting it out, and you're looking for alternatives. One of the things I wanted to emphasize with the acid watcher diet described in my book is that people are reporting that their energy levels have increased dramatically. And there's a scientific reason for this. As you're having a diet that has a lot more vegetables and fruit, and again, I want to emphasize, we're not cutting out protein, we're not cutting out carbs, we're not cutting out fat. It's just the types of food we're having are healthy and not processed. Almost everyone is reporting increased energy. And one of the key points there is the amount of fiber that's in the diet. In addition to acting as a virtual broom, as we discussed earlier, what fiber also does is it delays the input of sugar into the bloodstream. So it takes away the sugar spikes and lows, which leads to cravings. As you even that out, the body has increased metabolism, therefore increased energy. And one of the things that we've noted in the diet, and now I have data in over 600 patients, is that most people in the first 14 days on the acid watcher diet lose somewhere between 4 to 10 pounds and an inch off their waist. So while we don't tout this as a weight loss regimen, one of the unintended consequences and very positive effects of being on a low acid, high fiber, nutritionally balanced diet is that you will lose weight in addition to healing your body from years of acid damage.
Mike, thank you for your call this morning, and certainly good luck, too, on continuing the progress that you have made health-wise. Thank you for your call and your patience on the phone. Let's see. Next, we go to Connecticut to Tim, who has been waiting for some time. Tim, where in Connecticut are you?
Good morning. I am in Shelton, which is down in Fairfield County.
Good morning, Tim.
Good morning, Doctor. How are you?
Good.
Good. Quick question. Listening to your conversations, and they are all very enlightening, I was wondering if there are any indications that acid reflux has any kind of a genetic disposition. My father passed away several years ago and was very healthy his whole life, and ended up passing away of complications from esophageal cancer.
I'm sorry.
That's okay. He lived a pretty good long life, was very healthy. It came on quickly, but we all have lifestyles when we were younger. I grew up in an Italian household, so we had pasta several nights a week, and
right.
And now, even a slice of pizza or red sauce pasta kind of spurs a little acid reflux in me.
Right.
I have the over-the-counter remedies that I take, on a semi-regular basis if I do get a flare-up, but I was just wondering if genetics has anything to do with it, or if it's just a lifestyle change that needs to be made to rectify that situation.
Right. In general, it is lifestyle related, and what you describe is mirrored in our society. It used to be that the most common type of esophageal cancer was due to smoking and drinking alcohol to excess. And then again, around the late 70s, early 80s, it began to shift from what I call smoking and drinking related esophageal cancer to the acid reflux related esophageal cancer, which is where we are today. And you're absolutely right that you intuit that it's what we're eating that is predisposing to the situation. And in your particular case, what I would suggest, if you haven't done this already, is go to your doctor, explain your symptoms and your concerns and your family history, and ultimately you should have your esophagus looked at. And there are two ways to look at it. You can be sedated much like the type of sedation used in a colonoscopy, which is how gastrointestinal doctors examine the colon. Another option that a lot of people may not be aware of, and I talk about in my book, Killing Me Softly from Inside, is that you can have an unsedated exam of your esophagus, where a tiny camera, it's about the size, we talked about pasta, well, it's the size of a piece of spaghetti and just as soft, and it goes through the nose, so therefore you avoid the gag reflex, which sits in the mouth, and you're able to then look at your esophagus and make sure that there's nothing abnormal or terrible inflammation going on. So I think you're very wise to pay attention to your family history. You're very wise to pay attention to what you're eating and the symptoms that it causes. And if you haven't already, I would just make sure that your esophagus gets looked at. Again, there are ways to do it without being knocked out.
I appreciate that, Doc, and I'm going to get your book because it sounds like a lot of fantastic ideas on treating the problem. So I thank you very much.
Thank you so much, Tim.
Tim, thank you for your call this morning. Let's see. Next up is someone who you are familiar with, Dr. Aviv. Nick Zakla is joining us on our program. Nick is a colleague of yours.
Yes.
Nick, good morning.
Good morning.
Welcome.
Good morning, Nick.
Good morning, Jonathan.
What do you think of the discussion thus far?
I think it's wonderful. It's all about educating the public about this disease and the ways to find problems without having to again be sedated. I appreciate your previous caller calling in and that discussion about the transnasal approach to finding early disease that can be treated.
One of the things that the listeners may not be aware of is that Nick, who I actually write about in my book, Killing Me Softly from Inside, which is available on Amazon and Kindle, Nick was working with one of the companies that was pioneering the unsedated approach. But when Nick was in my office at Columbia University years ago, and it was in the mid-'90s, we realized that some of the instrumentation used to, say, look at the lungs could possibly be applied to the esophagus. And Nick was arguably one of the first people in the United States to have an unsedated transnasal esophagoscopy. What that means in English is that you're looking at the esophagus wide awake, and lo and behold, Nick had Barrett esophagus, which is a potentially premalignant change in the esophageal lining. So, Bob, you're speaking to two people who have these diseases and consequences of lifestyle. Me with my morning or middle of the night jump ups, and Nick with actually Barrett esophagus. And because we're so close to this problem, we are very, very motivated to help people, and frankly grateful to you for allowing us this forum to let people know what's going on.
It always amazes me the numbers of people who are interested in this topic and definitely want to get in and be able to ask a question, share some thoughts. Nick, I want to thank you for joining us. Let's see if we can work in another caller or two here, too. Ready?
Thank you very much.
Alrighty.
Thank you, Nick.
Now,
good work. Thank you.
Next up is, let's see, over in New Jersey, we'll go to Gary, who's been holding in Colts Neck for some time. Gary, thanks for holding on. Welcome to the Fan.
Hey, good morning, guys. Hey,
good morning, Gary.
Awesome conversation. You know, obviously I'm not a doctor, I'm a landscaper, but my wife's been struggling for years with fibromyalgia, and it's so crazy that I turn the radio on and I hear this because my wife started having issues with that, taking medications to deaden the pain. Now she's been kind of off medication, and she's just been doing, getting her body more alkaline, and it's really unbelievable what you're talking about, because I started doing the same thing, not drinking coffee anymore. I'm not coughing nearly as much, and I just, I wanted to find out a little bit more from my wife and actually my mother-in-law, because they've been really in a lot of pain over the years with fibromyalgia. And have you done any studies on that fibromyalgia? Because it's definitely helping my wife and my mother-in-law being more more alkaline, I believe. Because we have a lot of lemon in our water, and I drink a lot of green tea instead of coffee. And I don't know, I just thought it was really interesting, and I think you hit it right on the button here.
Okay.
I wanted to find out about my wife, if I could help them out.
All right, I'm going to let Dr. Aviv respond to you on the air. We're a little bit tight on time. Thank you for your call this morning, Gary.
Gary, the one of the key points, Gary, is that these diets, like the Acid Watcher diet and some of the diets and foods that you're eating, they're all anti-inflammatory. And anti-inflammatory, as Bob said in the beginning, will help prevent the heart attack, will prevent the NAF-related issues with acid reflux, and also heal the body generally. So what you're describing in terms of the fibromyalgia and the body pain being healed with a anti-inflammatory diet, I completely agree with you.
Very interesting discussion, as I thought we would have with Dr. Jonathan Aviv on our program. Henry from Union, New Jersey, would not, unfortunately, have time to get to your question this morning. I apologize on that. Dr. Aviv's book, Killing Me Softly from Inside, The Mysteries and Dangers of Acid Reflux, and its connection to America's fastest-growing cancer with a diet that may save your life. Dr. Aviv, thank you very much for joining us on our program today.
Thank you so much, Bob, and thank you so much for taking the time to improve the health care of your listeners.
Thank you.